Hello, my name is Natalie. Welcome to my vital signs video. I do not have children and subsequently do not even have stuffed animals around the house, but I do happen to have actual animals. So Sadie here will be having her vital signs taken today. If you happen to see a ball of overexcited red floof appear in the video, that is my other dog, Nova. We call her my lab assistant, but she's more of a pest, so just ignore flying red floof. She's right here on the floor on my foot. So this is Sadie. Obviously, we have to make some considerations because Sadie here is not human. So if we were dealing with a human, I would introduce myself first. Hello, Sadie. My name is Natalie. I am a nursing student. I am here to take your vital signs today. Is that okay? Yes. We're gonna go with yes, that's okay. So obviously obtain consent and then verify my patient. Now Sadie, conveniently, has a collar on. Sadie's also quite concerned because the wind is making our screen door creak, but that's okay. Hi, lab assistant, can you go away, please? Thank you. Oh, good girl. Nova, sit. Yes, stay over there. So Sadie's collar is in fact labeled with her name. Her name is Sadie. It includes my phone number. Sadie. Yes. So Sadie made eye contact with me when I called her name. I'm going to use that as confirmation that I have the correct patient. I happen to know that Sadie's birthday is June 6th. We actually have no idea how old Sadie is, so I cannot verify a year, but we're going to go with I have confirmed my patient. Now the video that we saw of the other RN, I actually really liked that she started by asking about pain as one of the vital signs. Sadie, are you in any pain today? I think this is a good opportunity. Hey, lab assistant, go away. Thank you. Nova, sit. Yes, down. Good girl, thank you. I think pain is a great way to kind of build some rapport, get to know your patient, and also know ahead of time if you need to take any considerations while taking vitals. For example, if their left arm is the arm that has pain, maybe we use our right arm for blood pressure and pulse instead. So Sadie, are you in any pain today? No, I think Sadie just wants more belly rubs. So for Sadie here, I'm going to start by applying the pulse ox. Lab assistant, go away. Thank you. I'm going to start by applying the pulse ox, which I do actually have. However, with dogs, lab assistant, go away. Nova, go. Thank you. Nova, sit. Yes, wait. You stay there. Hi. So with Sadie, she is a little bit of a shy dog. I know this because I've known Sadie for so many years. She's a little bit timid. Some of this stuff kind of makes her nervous. I've taken a moment before starting the video to introduce her to the blood pressure cuff, but this is her first time seeing the pulse ox. Now, doggy paws are quite different from human paws. So in applying the pulse ox, I doubt that it will get a reading. And as I look at the screen of my pulse ox, hi crazy, there is no reading. I can try this on her ears. If we take her to the vet, this is more commonly where the vet will obtain a pulse ox. She's really not a big fan of it, but you're doing so well for me, baby. She prefers to sniff everything. For humans, however, for pulse ox, I can put it on myself. I'm looking for an oxygen saturation between 95 and 100%. Obviously anything below that would be considered out of the reference range. For heart rate, we are looking for a pulse of between 50 and 100. Right now I am satting at 99% with a pulse of 70. Sadie. Sadie, we have some alternatives. I know sometimes my vet will take a look inside their ear where the fur isn't anymore. You can essentially do the same thing as a cap refill. In Sadie's case, color returns in less than 2 seconds. With children, I know that is a very common thing to use as well. So that is our pulse ox. Sadie, you did so well. Now the pulse ox was able to tell me her pulse. If I needed to take it manually, dogs actually have phenomenal femoral pulses, and I would be able to take Sadie's pulse by feeling her femoral and counting either 15 seconds, multiply my number by 4, 30 seconds, multiply by number by 2, or if I felt any irregularities or abnormalities, would count for an entire minute. Now, while I've been doing all this, I have been noting Sadie's respirations. I have not been formally counting because I have been talking and I can't count and talk at the same time. But Sadie's respiratory rate is usually a little bit faster than a human's, her being a dog. Granted, if I were to do this on Nova, Nova is panting because she's very excited right now. That would definitely be considered abnormal respirations outside of our reference range. Normal adult respirations run between 12 and 20. Sadie's respirations are currently going to be a little bit closer to about 30, which is normal for a dog, especially a dog of her size, and given that she is lying down and resting. If I needed the assistance, I am watching the side of her, and it's actually really easy while she's in this position to see chest rise. However, I am also in a poor position to see equal chest rise as she's kind of flopped over on one side. This would be easier if she was either standing or sitting upright so I could see the entire chest and both sides of it. Well, now we're sniffing, so we have a very abnormal respiratory rate. In this particular case, I was just watching the chest rise. If I needed more assistance, she loves the contact, so it would be all too easy for me to just rest my hand and feel her intercostal muscles work as she expands her chest and breathes for me. We're sniffing again. Oh, you want belly rubs? Okay, you can have belly rubs. That's my good girl. So we have covered pain, pulse, oh, blood pressure. I haven't tried taking her blood pressure yet. I knew I was missing one. So for blood pressure, I have my handy dandy adult blood pressure cuff. What do you think, Sadie? Does that smell good? She licked it. Okay, baby girl. Is it okay if I take your blood pressure? Oh, are you bored of this? That's okay. So for my Sadie, I can try to apply this to an upper arm. In an adult, this would be going around the bicep area, the upper arm. Ideally keeping it up fairly close to the pit, the armpit, the axilla, because up here it's a little bit easier to find that good strong pulse. Now, Sadie is not a big fan of this guy, and that's okay. I'm not here to scare her or freak her out, and she's just straight up gonna leave me. But all the dogs are gonna leave me, that's fine. So for an adult blood pressure, we want this on the arm, the upper arm, where we can get a good reading. We want their arm resting at the level of the heart. We want them relaxed and comfortable. Hi, do you want me to take a blood pressure on you? We can try Nova. Are you gonna let me? Nova is a little bit braver, but she's also a little more squirrely. So we shall see. But like I said, this is gonna go on the upper arm. It's supposed to take up about 40% of the arm's circumference in order to be deemed an adequate fit. You want it snug, but not overly snug, and we want the right fit so as to not distort our numbers. As you inflate the cuff, you go about 30 millimeters of mercury above the expected blood pressure, and you let it out with the needle falling at about 2 millimeters of mercury per second. We don't want to go any faster than that, again, so that we can get the most accurate reading possible. For an adult, our average blood pressure is about 120/80. If we were to encounter any unexpected findings, Sadie, stop licking the table, then we would stop, report, investigate, make sure that it wasn't a bad reading or that something else wasn't going on. Hi, Nova. Are you gonna let me take pulses on you, baby? What's your pulse? Oh yes, the dogs just like the belly rubs. You have a nice strong pulse, girl. Oh, no, okay, you're over it, you're done. You think you're at the vet now? I know, that's what the vet does to you too. We don't like the vet. The vet's no fun. And that's going to conclude my vital signs video. Thank you so much for watching. I have lovely lab assistants. Obviously, we had to make many compensations given that they're not even human, let alone the wrong sized humans. But they're good sports and they let me torture them. So thank you, and until next time.